Welcome to Dentition and Swallowing in Adults by Caroline Wogan and Kelly Say. These are some common misconceptions about patients without teeth. Some of those are a patient with no teeth is not capable of managing solid consistencies. Indigenous patients should be on a pureed diet. If a patient is on a pureed diet, they need their medicines crushed, and any denture is better than none. In the next few slides, we will go over why these are just misconceptions and why they're not true. These are some common Oral health and swallowing problems. Oral health is defined as being free of diseases and disorders that limit a person's ability to bite, chew, smile, speak, and overall psychosocial well-being. Some of those diseases include Parkinson's, oral pharyngeal and laryngeal cancer, and other symptoms may include facial paralysis, cerebrovascular disease, parathyroid tumors, jaw arthritis, deficits with your jaw, or surgery of the laryngopharyngeal region are all different types of things that could affect your overall oral health. Proper oral hygiene is essential for preventing aspiration pneumonia, and if oral care is not sufficient, general health, including swallowing, will worsen. Mechanisms that are important for oral health include oral transit time, proper mastication, tongue and bite mechanisms, and making sure that you can properly propel a bolus. Oral health. Chewing and swallowing. Dentition is a key aspect in chewing and swallowing of food. For example, bite force has a lot to do with this. It takes about 45 pounds of bite force to chew roast beef, whereas it only takes about 25 pounds of bite force for lettuce. As you get older, you lose your bite force, and when you don't have enough teeth, your bite force isn't going to be as hard and it's going to be more difficult to swallow food. Chewing serves as several purposes, breaking down large food into smaller pieces, and it also helps in lubricating and softening food in a cohesive bolus. That makes it much easier to swallow. And the mastication performance, or how efficiently you can chew, is greatly affected by the number of teeth and dentures. Of course, if you don't have as many teeth, it's going to be a lot harder to chew your food and to make a cohesive bolus in order to swallow. And this is where it's very important to exercise those muscles of mastication. As we know, the best exercise for a swallow is to actually swallow. Effects of tooth loss. So about 30% of 65 to 74-year-olds in the United States have no natural teeth. And those could be from factors relating to poor oral care or not being able to afford services, to go to the dentist, to get teeth fixed if you got maybe a car accident and some of those got knocked out. It could be anything that has to do with that. Tooth loss reduces chewing ability and efficiency of the oral preparatory stage of swallowing. So that increases the number of chews, inducing fatigue. So if you don't have as many teeth, of course you're going to have to chew your food a lot longer to get it to a bolus size able to swallow. And then also decreasing bolus viscosity. So imagine if you don't chew a piece of meat very well, it's going to hurt and take a lot longer to go down your throat. Whereas if you eat pudding, something that you don't have to chew, it slides down your throat much more easily. Bolus size increases with the increasing number of teeth loss. So again, if you don't have enough teeth, you're not going to be able to chew your food as much, and it's going to have a larger bolus size. A larger bolus size negatively affects the smoothness and efficiency of bolus movement to the pharynx necessary for a safe swallow. Effects of dentures. Improperly fitting dentures have the same effect as not wearing them. They, in turn, cause problems with the swallow. So when you wear dentures that don't fit correctly, you already have a delayed sensory input in the oral cavity, because taste plays a huge role in the normal control of voluntary swallowing. So on top of having dentures in, if they're not
fit properly or not in the correct position, then it makes swallowing all the more difficult. So improperly fitting dentures greatly increase the duration of the swallow and the oropharyngeal swallow efficiency. So if those durations are increased, then the risk of aspiration increases as well. So when the dentures are removed, this creates a different effect than when the dentures are worn. So wearing dentures decreases oral transit time, which also increases the risk of aspiration. So, like I said, the decrease in sensory input in the oral cavity is pretty dangerous when it comes to relating to aspiration. And the pharyngeal transit time is shorter when wearing dentures, and the opposite of that would be a prolonged pharyngeal transit time that increases the risk of wearing aspiration. So the pharyngeal transit time is decreased when wearing dentures, which is beneficial to those patients who wear dentures. Effects of dentures. The top 5 foods to avoid when eating with dentures include corn on the cob, apples, nuts, steak, and staining beverages such as coffee and wine, because the stains may stain your dentures and you'd like to keep your dentures as in the best condition as possible. Corn on the cob might get stuck in between the dentures, and steak can be difficult for chewing as the dentures might fall out. It is important to note, though, that when certain fruits, vegetables, and nuts and meats are avoided, they can have dietary insufficiencies in these patients with dentures, such as a lack of folic acid, vitamin C, vitamin E, fiber. So it's very important just to make sure that when you're avoiding certain foods that you aren't missing out on others. And it's recommended that you eat soft foods, hot cereals, applesauce, mashed potatoes when you first get your dentures, just to make sure that you can get used to them, and then you can slowly build up a tolerance, because just because you have dentures doesn't mean that you can eat steak. There are just certain people that avoid it because it's uncomfortable for them when they first get their dentures, or they have a fear of the steak getting lodged in between their dentures. So a lot of the things that people avoid can be based on preference. You just have to make sure that you're getting all of the dietary needs to make sure that you maintain your healthy body weight. The top 5.
Teeth brushing. Teeth brushing is not only important to oral health, but it's also important to saliva production. So in people who have medicine-induced dry mouth, or exerostomia, which also means dry mouth, it is needed to facilitate a normal and safe swallow. One of the articles we looked at reported that elderly people with toothbrushing frequency less than twice per day were more likely to have a dry mouth. Teeth brushing activates the impulses to the salivary tissues, and it's also important because it stimulates the oral and pharyngeal regions to help produce the saliva, which are involved in the first and second phases of swallowing. So some of the things that saliva does is it helps in bolus formation, it facilitates the mastication and swallowing, and it also helps to solubilize the food substances that you're trying to swallow. So brushing teeth prevents oral decay, and it just helps keep an overall clean mouth.
Important reminders that we would like to send you all home with is to make sure that you brush your teeth so that you don't have to worry about your teeth falling out or you just having poor oral care. Take care of your dentures if you do have dentures. You want to make sure that they're fitting properly, that they are not uncomfortable, that they're also not, they don't have bacteria on them if you're not cleaning them. Also, when eating, make sure that you chew adequately so that you have a safe swallow, and be aware of aspiration issues, even though you may not realize you're aspirating, or a patient of yours is aspirating, but also make sure that you are taking into account the times that they're coughing and how often they're coughing after they're swallowed, just to make sure that you're aware of aspiration. Use dentures appropriately to maintain jaw stability. So if you are someone you know is beginning to lose their teeth, you might as well get dentures as soon as possible just because you want to maintain that jaw health. Eat a balanced diet for your dental and overall health, as we talked about, making sure that you intake all of the necessary things to stay healthy and to maintain muscular function of chewing muscles and mechanisms to avoid atrophy. So just to make sure that your chewing muscles are in order and that you can properly chew all your food.